This is my analysis of the Innovus Bio press release. This clinical trial is considered a phase 2 or 3 study. It enrolled 353 patients, which is consistent with the typical sample size of a phase 2 trial. The objectives are a mix of phase 2 and 3 objectives. Phase 2 typically focuses on efficacy, while phase 3 trials also study different dosages. A commonality of both phase 2 and 3 trials that's present in this study is the continued safety monitoring. The clinical trial evaluates the impact of buntanetap, a once-daily oral medication, in patients with either mild or moderate early-stage AD, taking efficacy, safety, and tolerability into consideration. It compared the effectiveness of different doses of buntanetap. The design of this trial was randomized, double-blind, and placebo-controlled. Over 700 patients were screened to determine if they met inclusion criteria. If met, the patients were enrolled and endured 12 weeks of treatment on top of standard care. 353 patients from different centers in the U.S. were enrolled to the study and randomly assigned to placebo, 7.5, 15, or 30 milligram doses on a 1:1 to 1:1 ratio. The study analyzed two co-primary endpoints, the changes in ADAS-Cog11 and ADCS-CGIC from baseline to 12 weeks. These endpoints were meant to be studied jointly, accounting for correlation between the two, and as one hypothesis, so there was no multiple testing. Here's the detailed estimand with its 4 components. I previously discussed the population and variables. Listed are some possible intercurrent events that could occur. If these events did occur, we would need to check for dropout due to bias through sensitivity analysis. If these events are not due to randomness, we would need to implement some sort of follow-up. The population level summary will be discussed more in the statistical analysis plan. Now I'll share my plan had I been involved in this trial. I would compare the difference in mean change in ADAS-Cog11 from baseline to 12 weeks between each treatment and placebo, and do the same for the other co-primary endpoint, ADCS-CGIC, jointly. My null hypothesis is that there's no difference in the mean change between each treatment and placebo group in both co-primary outcomes, and my alternative hypothesis is that there is a significant difference in the mean change between at least one treatment group and placebo group of both co-primary outcomes. To test my hypothesis, I'll conduct a MANOVA test using the model shown, testing at the 0.05 level. All enrolled patients for whom there was an intent to treat will be included in the analysis. To analyze my results, we'll include a table with relevant coefficients and p-values. If both co-primary endpoints tested jointly are significant at the 0.05 level for at least one treatment, we can reject our null hypothesis. We'll then perform contrasts to compare each treatment dose and placebo, making sure to correct for multiple testing through a method such as Bonferroni. Unlike my statistical analysis plan, the press release does not test both co-primary endpoints jointly and instead tests 2 independent tests and deviates from the protocol. As seen in the figure, they try to suggest significant results while only mentioning one endpoint. They also included unnecessary within-group comparisons in addition to their between-group comparisons that create a multiplicity issue. They also do not include all enrolled patients in the analysis and actually drop them due to some protocol that was not specified in the original study design. This is concerning since altering the study population disregards patients that originally had intent to treat. Excluding these patients could create selection bias and makes the results not generalizable to the original specified target population. Another concern is that the randomization ratio could be altered. Since these changes were not pre-specified in the original trial design, important operating characteristics such as power, type 1 and 2 error considerations are unknown. Due to these concerns, the fact that the investigators did not jointly analyze the co-primary outcomes altered the study population and did not follow the prescribed analysis plan. My conclusion as a statistician is that the press release from Innovus does not provide strong evidence that buntanetap might be effective for treating Alzheimer's disease.